Hello, my name is Jill Berry Bowen, CEO of Northwestern Medical Center, your host of the NMC Health Beat Show, and it's dedicated to discussing hot healthcare topics. So today we welcome Dr. David Simcoe. Dr. Simcoe is a physician at Northwestern Occupational Health, but also the Georgia Health Center as well. And he just started with us in the summer of this year. So we're interested in finding all about him today, certainly. But specifically today, we're going to be discussing occupational health medicine because there's so much we don't know about it. So it'll be interesting to have that discussion. So Dr. Simcoe, thank you for joining us today. And since you are new with us, I bet folks first would like to know a little bit about who you are.
Sure. Well, thank you for having me. I am David Simcoe. I graduated from medical school in 1999. I finished my residency in family practice in 2002. I then went on to practice family medicine in 2002 and practiced specifically and only family medicine until about 2009. And in 2009, I had this wonderful opportunity to start practicing urgent care and occupational medicine as well. I was taught by some really, really good occupational medicine specialists and have been practicing occupational medicine and urgent care ever since. Until now, I do family medicine and occupational medicine and urgent care, all three of them together.
Wow, wow. And I just want to say thank you first, before we get started with the questions about occupational health. Because when you first started, you were going to be doing occupational health for us and working at the Georgia Health Center to develop a family practice. And we were starting our urgent care, and with all of your experience, you jumped right into our St. Albans urgent care and really gave it an incredible start. So I want to thank you for that.
Well, you're welcome, and thank you for giving me that opportunity. It's a very important service that we're offering the community. I'm very happy to do that.
Yeah, it is, and your expertise just is a great kickoff to our program.
Well, thank you.
So, occupational health medicine. So, could you tell us what that is?
Absolutely. Occupational health medicine, it's a specialty that a lot of people don't really know about. It's almost like a branch of preventive medicine. We're really looking at the interaction between an employee's health and their workplace. So in a sense, we're looking to treat injuries, and we're also looking to prevent injuries. So in a sense, it's very preventive, and it's involved in the workplace and in our office. And that's basically what we do.
So what type of injuries do you actually see? What's the kind of the common injuries?
The most common injuries that we see in this environment, in this type of occupational medicine that we practice, are musculoskeletal injuries. So, for instance, a lot of low back injuries, shoulder injuries, arm injuries, leg injuries, things that occur at work involving accidents for the most part. Mm-hmm. However, there are other types of injuries that occur which are what we'd say maybe overuse injuries. So, for example, the employee who uses a jackhammer all day is at risk for carpal tunnel. And although that injury isn't necessarily acute, meaning they didn't necessarily fall, when they develop carpal tunnel from using that jackhammer, that's something that we would evaluate and help them develop better ways of doing things and treat that injury as well.
Mm-hmm. So you not only work with the patient that's injured, but you must also work with the employers as well. So how does that relationship work?
Well, working with the employers is very important because it's where we can impact the employee's health in a very meaningful way. Firstly and foremost, having an open line of conversation with the employee and employer together is very important. So, for example, after an initial injury, calling the employer and discussing the injury is very helpful, not only to help the employee get better quicker, but to initiate some change, hopefully, at their place of employment, and to bring the employer on board to what's going on and to help them help us and help the employee. So that's what we would do there in that sense. Also, we send people over to the places of employment to help and evaluate workplace safety as well.
Good, good.
So whether it be a workstation or a desk or anything, if we see the risk for something that can cause injury, well, that's preventive medicine. We can jump in right away and hopefully help the employee and employer make changes at their work site.
Great.
Yeah.
So what does the terms work hardening mean?
Well, work hardening for an employee who is injured, work hardening helps mimic a workplace in a safe environment with the physical therapist. So if someone is injured and we'd like to get them back to their place of employment, we work with the therapist to help that employee, depending on what their job description is, get back to work in a safe way. By mimicking a lot of the lifting and or activities that they may do at work, we determine if they're safe to get back to work and at what capacity they're safe to get back to work at. We can determine that with the help of therapy together. So we have a very good work hardening program that I work with some very capable and competent physical therapists, and we work as a team with the employer and with the employee to help these injured employees get back to work.
So you mentioned therapy. So
Yes.
one of the things I've been always confused about is what's the difference between physical therapy and occupational therapy? It seems to be a difference. So,
Yes. Very good question and a very common question. Physical therapy and occupational therapy. Well, physical therapy, I think, is people know more about physical therapy. Most people have a lot of experience with a physical therapist if they've been injured somehow. Maybe they had surgery, they need to rehab their surgery. They go to the physical therapist for low back pain, for knee injuries and such. Occupational therapists apply a lot of the same techniques and things that a physical therapist would, except that they apply it to activities of daily living if it's not in a work type environment. If it's a work type environment, they're activities that they would do at work. They also tend to focus on the upper extremity, the hand, the wrist, the elbow. So, for example, if you came to see me or an injured employee came to see me with a diagnosis of carpal tunnel, they would be more likely to see an occupational therapist than they would a physical therapist. But that depends on the location that the service is being provided. We are lucky enough to have both occupational therapists and physical therapists, so which is wonderful. And so when we order a physical therapy consult, we do physical therapy / occupational therapy, and then the therapy department determines whether or not this employee needs physical therapy or occupational therapy.
great, thank you. That's a great description of that. Helps with the confusion.
Oh, absolutely.
So how important is it to get someone back to work? Do you like them to be out of work for a while, or how do you work with the employer to get folks back to work?
That's a wonderful question. The way I see it, first and foremost, is that we like to keep people in work. This is where people hopefully are going to go on and make a living the rest of their lives. And the last thing we want to do is take them away from that environment. We want to encourage them to be actively involved at their place of work, even if it's with a restriction. We know that when we keep people involved at the workplace, even if they're injured, they tend to get better faster and they tend to go back to work eventually. If we keep people out of work, even with an injury that requires restrictions, we know that they're less likely to go back and be involved at work. And what's more important than to keep people involved at work? People want to make a living, and people need to make a living. And it's in their best interest to go to work with some sort of activity restriction. And this is where we work hard and where we hopefully work with the employers to encourage their employees to follow restrictions and stay at work, even if they have to create a different position for them for the meantime. Very important.
I love that you work as a team with the employer, the employee, and just wrapping around them to help them get well and back to work. So that's really cool that that's such a wraparound and embracing that employee.
Definitely a team effort.
Yeah.
Definitely we all need to work together, and it's wonderful.
Great. Now, Department of Transportation exams, do you do those, and what changes are happening with those exams?
Yes, I do those exams, and all of our providers do those exams. What has happened is that all of the providers who provide that service, that physical exam, have to be certified through the DOT now to do these exams. And what has happened is that it's not necessarily that the standards have changed. It's that the implementation and the application of these standards has become more stringent and more something that the DOT is actually observing and watching. So, for instance, I'll give you an example. The recommendations for diabetes, when they have always been there, they've been there for years. There has never been a standard way to bring all the providers who provide this service together so that we're all hopefully doing the same thing now. So now, instead of looking at those recommendations and doing what you want to do as a provider, hopefully we're all following the same standard together. It seems in some ways that these have gotten stricter, but in reality they really have not. And we're also have to bring these exams to the DOT. They review these DOT exams and make sure that we're following these standards. So it's very important because, again, it's a sort of preventive medicine. The safety of these drivers and the safety of our roads are at stake when we do not follow these guidelines.
It's interesting how you're using, consistency and protocol and standards, because that is the direction that we're all moving in. When you think about healthcare reform and looking at clinical outcomes, that we're doing things in standard ways so that we can improve clinical outcomes. So it's fun to hear you say consistency. So it's great that that's happening across the community for sure.
Yeah.
So we don't have much time left, but
Sure.
I know you're also working at the Georgia Health Center.
Yes.
So
Yes.
how's that practice developing for you?
I'm enjoying it. I am practicing family medicine, applying preventive medicine as well to family medicine, enjoying it a lot, getting back to my roots, seeing new patients, and working with my colleagues at the Georgia Health Center, who are all just wonderful people. I gotta say, I really feel very lucky. Just a really nice group of people, easy to work with. We all work together as a team, and we've just got a nice family practice going there. Definitely enjoying it.
That's great.
Yeah.
So where can we find you? Obviously at the Georgia Health Center, and then where is occupational health provided?
Occupational health is provided behind the hospital in the building there.
Oh, that cobblestone.
The cobblestone,
Right.
yes.
Out behind. Yep.
Behind there.
Yeah.
We also, however, provide occupational services at our Georgia walk-in.
Okay.
And also after hours at the St. Albans Urgent Care as well. So we work together with them. It's all one big team. It's really quite wonderful.
Super.
Yeah.
So what's the safety tip to help folks keep safe? What would you say would be things that folks could do to live a safer lifestyle?
Great question. Well, I would say make sure that your workstation is ergonomically correct.
Yes.
That's a big one. Yeah.
That is so true, because a lot of us spend a lot of time there at work. So making sure your station and workstation is good for you and fits for you.
And get your flu shot.
And get your flu shot. That's right.
Yeah.
That is so right. Well, Dr. Simcoe, you have been a wonderful guest, and I'm sure we've all learned a lot more about what occupational health medicine is. So thank you so much for being here.
It's been a pleasure.
And this is Jill Berry Bowen, CEO of Northwestern Medical Center, thanking you for joining us for the NMC Health Beat Show.